The next antibiotics are the protein synthesis inhibitor. These are the cell inhibiting the 50S ribosomal unit. So the first C is for chloramphenicol. Chloramphenicol. Precisely, it inhibits 50S ribosome and inhibits transitions, but precisely it's a peptide peptido peptidyl transferase inhibitor, and causing inhibition of the protein synthesis. So translation inhibitor, and its resistance, it's actually mutate by plasmid encoded mutation of this acetyl transferase. If we mutate this site, then the drug is no more effective. Its side effect is it can cause anemia. If it is dose dependent, then it can cause simple anemia. Dose dependent. But if it is dose independent, then it can cause aplastic anemia. Independency. Also, it can cause the most important, the gray baby syndrome, in which the baby do not have a mature hepatic enzyme, UDP glycotransferase syndrome. That's why it cannot remove that amphenicol from the body. So it leads to the formation of gray baby syndrome. So where we use chloramphenicol, so clinical use is we use in the rickettsial tick-borne diseases, especially the rickettsia, and also we use it in the Shine bacterial meningitis, strep pneumo, Haemophilus influenza, and Neisseria. The next C is clindamycin, and it is 50S inhibitor, but it inhibits translocation, precisely inhibit the translocation. So its side effect is very much important. It can cause pseudomembranous colitis, very much tested, and its clinical uses are we can use it for anaerobes, particularly the bacteroides and Clostridium perfringens, and these anaerobes can cause the aspiration pneumonia. They can cause abscess, lung abscess. They can cause oral infections, and also we can use it in invasive group A streptococcal infection. So the next we have the most important family is macrolides. There are 3 types of macrolides. We have calithro, azithro, and erythro. Macrolides are also one of the most overly prescribed medications. So macrolide, they actually precisely inhibit translocation in the protein synthesis. So if we want to resist the bacteria, just methylate macro, so methylate, or make the site inactive, methylate or inactive, for the medicine to be ineffective. So methylate the site where this actually effect on the ribosomal 23, the subunit of the ribosomal RNA. So methylate that site, so no effect of the, we can resist macrolide. So the side effects are very much interesting and very much important. We have the macroside mnemonic. For M we have the motility. So its side effect, it can cause diarrhea. For A, we have the arrhythmia. It prolong QT, so avoid for heart patients. C, it can cause cholestatic hepatitis. R for rash, E for eosinophilia. Also, the calithro and erythro are the P450 inhibitors. So they can cause all the function the other P450 inhibitor can do. And the clinical use, where we can use macrolides. So macrolides are very much important in all the atypical pneumonia by the mycoplasma, chlamydia, and legionella. It can use for STI, especially for chlamydia agent. It can cause pertussis. It will be used in pertussis, and also it is used in penicillin allergic patient suffering from gram-positive cocci. So after macrolides, we have left linezolid. So linezolid, it actually inhibit the formation of initiation complex, which is formed by the initiation factor, and it inhibit the 50S of the ribosomal subunit, inhibit the initiation complex. So how to resist this? We just mutate the ribosomal RNA, which is used in the initiation complex. And what are the side effects of this linezolid? It can cause bone marrow suppression, especially the thrombocytopenia. So there is a bleeding problem, thrombocytopenia. Also, it can cause serotonin syndrome because linezolid has a partial MAO inhibition, and also it can cause peripheral neuropathies. So where we use linezolid, we very much effectively use linezolid in the gram-positive multiple methicillin-resistant Staph aureus or vancomycin-resistant enterococci. Very much important pathogens.